This year's World Aging Day brought together hundreds of older adults together in Accra under the theme Improving Healthcare and Well-Being for the Elderly. The event, hosted by Global Healthcare for the Elderly, combined fun and fitness through aerobics, games, and fresh coconut with serious conversations about life after work. Many retirees shared concerns about isolation and inadequate pensions, urging government to review tax policies on pension contributions to provide stronger support for retirement.
Basically, it has to do with it is isolation and then the poor remuneration. Well, we say that it is what you put in that you take. Have you looked at it? While you were in employment, you realize that workers pay more tax, twice more than they pay for SNET. It is not our doing. It is the government. So if the government will reverse it for us to pay more into the SNET fund than what we pay for tax, I think to go at the end of the day, it will kneel to the benefit of the retiree.
One of the things I personally think, and I've talked to some TUC people, is that we must make sure that our salaries are consolidated with our allowances, so that our salaries become big. Because the bigger your salary, the better your social security after you retire. I've known people who have had exceptional allowances with small salaries. Whilst they were working, they were quite happy. Suddenly they go on retirement, the allowances cease, and then the amount by which states should pay them is so negligible.
The Executive Director of Comic Relief Healthcare, Dr. Edward Danso, warned that a shortage of geriatric specialists continues to limit quality elderly care in the country.
I think we professional geriatrics we lack them. There are not too many of them, especially at the specialized level. If you go to our hospital, there are not too many. You won't even find too many hospitals that have departments that are specialized in there. So we know that taking care of the aging is something doctors must have compassion for aging to go into that branch, and this is something that we urge. We are training so many doctors now in Ghana, and some of them should look at that area.
In response, Daniel Fiawotro of the Gender Ministry revealed the government is partnering with the Health Ministry to train more specialists to close the gap.
So we realize that the number of trained geriatrics in the country are few, and looking at the number of older persons that are emerging, there's a need for us to train more geriatric care, specialists to be able to take care of older persons. Yeah, so that's what we are going to collaborate with the Ghana Health Service in the training of geriatric specialists.
The Deputy Director of Social Welfare, Victoria Bishop, also urged the working class to start preparing now for life after retirement.
I would say that families, individuals, and our communities should take up responsibilities to cater for their aging parents. It's very important whilst we work, we put in place plans that will take care of our future. So everybody should try to do something profitable, something sustainable, that when you are out of your work on retirement, then you can actually depend on it.
As the clock ticks, retirement is never as far as it seems. The message is clear. Plan and invest today for a secure tomorrow. Carlos Caloni, Joy News, Accra.